Weight loss medications like Ozempic, Mounjaro, and Wegovy have skyrocketed in popularity, promising rapid weight loss and improved health for millions struggling with obesity and diabetes. But beneath the success stories and dramatic transformations lies a growing number of patients facing an unexpected and devastating consequence: vision loss. Reports from those who have taken these drugs paint a harrowing picture of individuals who set out to improve their health only to find themselves permanently disabled, struggling to adapt to a life without clear sight. James Norris was one of those people. A 56-year-old mechanic from New Jersey, Norris had battled weight issues for years, trying every diet and exercise plan without lasting success. When his wife lost 60 pounds using Mounjaro, he was convinced to try it himself. At first, the results were exactly what he had hoped for. He shed nearly 90 pounds, his blood pressure improved, and he was able to discontinue medication for cholesterol. But then, his world quite literally started to go dark. Just weeks after his doctor increased his dosage, Norris woke up with blurry vision in one eye. Soon after, the other eye followed. What began as a seemingly minor issue soon escalated into a life-changing diagnosis: non-arteritic anterior ischemic optic neuropathy, NAION, a condition that leads to sudden and irreversible vision loss due to restricted blood flow to the optic nerve. For a man who had spent his life working with his hands, the impact was crushing. Unable to continue his trade, Norris was forced to shift to administrative work, his independence and livelihood shattered. The most terrifying realization? He had never been warned this could happen. Like many others who took GLP-1 medications, he was under the impression that the worst side effects would be mild nausea or stomach issues, never blindness. Recent studies are beginning to confirm what these patients have already lived through. A review published in JAMA Ophthalmology found that patients taking semaglutide or tirzepatide, key ingredients in these drugs, developed multiple serious eye conditions, including optic nerve inflammation and NAION. An even more alarming study from Mass Eye and Ear at Harvard Medical School found that diabetics taking these drugs were 4 times more likely to develop NAION, while those using the medications strictly for weight loss were at 7 times the risk. These numbers suggest a concerning pattern, one that drug manufacturers have failed to properly disclose. While the pharmaceutical companies behind these drugs acknowledge that changes in vision are a possible side effect, they stop short of explicitly warning about the risk of permanent blindness. Novo Nordisk, the manufacturer of Ozempic and Wegovy, has denied a direct link between their drug and NAION, stating that the disease is very rare and not considered an adverse drug reaction. But for patients like Norris, the growing body of evidence suggests otherwise, and lawsuits are beginning to pile up. Michael Sabalico, a 60-year-old from San Diego, never anticipated that taking Ozempic to manage his type 2 diabetes would leave him with permanent visual impairment. When he started the drug, he weighed 185 pounds and had near-perfect vision. Within 2 months, he lost 5 pounds, but then his eyesight took a drastic turn. His optic nerve became inflamed, leading to an NAION diagnosis. Even after stopping the medication, the damage was done. He now has 20/70 vision in one eye and struggles to read. Sabalico, like many others, had no idea he was putting his vision at risk. Even more heartbreaking is the case of Cheryl Bovey, a 56-year-old woman from North Carolina who took Ozempic as prescribed by her doctor to control her diabetes. She wasn't using it for weight loss. Yet, despite following medical advice, she ended up legally blind. Now unable to work, drive, or even walk safely in her own neighborhood, Bovey has lost more than her vision. She has lost her independence, her career, and the future she had envisioned for herself. "I no longer have the hope of seeing my grandchildren. I no longer have the hope of seeing their faces clearly," she said. "All of my hopes and dreams have been dashed." These are not isolated incidents. Attorneys handling cases related to GLP-1 medications and vision loss report receiving hundreds of inquiries from affected patients. The scale of the issue is only now coming to light, raising serious questions about whether these drugs were adequately tested for long-term safety. If the risk of NAION is as high as emerging studies suggest, then millions of patients worldwide may unknowingly be gambling with their eyesight. Pharmaceutical companies continue to stand by their products, insisting that the benefits outweigh the risks. And for many, These drugs have indeed been life-changing in a positive way. But what if the price of rapid weight loss is permanent disability? How many patients would willingly trade a slimmer figure for blindness if they had been properly warned? Public health officials and regulatory agencies must take these findings seriously. The FDA and other governing bodies should immediately reassess the safety profile of GLP-1 drugs and consider stronger warnings or additional restrictions, especially for patients with pre-existing vision conditions. It is unacceptable for people to be prescribed a medication without full knowledge of its potential consequences. The push for weight loss solutions has led to a gold rush in the pharmaceutical industry, with companies eager to cash in on the demand. But this rush for profit cannot come at the expense of patient safety. History has shown time and again that medications hailed as breakthroughs can later reveal hidden dangers, sometimes with devastating consequences. For those who have already lost their sight, no amount of research or legal action can undo the damage. But for the millions still taking these drugs, urgent action is needed. The question is not just whether these medications can help people lose weight, but whether they are worth the risk of losing something far more precious, their ability to see.